The choices we make could be killing us when it comes to cancer. Most non-inherited cancers are linked to the foods we eat, our physical activity, and lifestyle choices. Making changes, we may be able to change our risk. Topping the list of preventable cancers are skin cancers.
There are very few people that have a genetic predisposition, but that's fairly rare. Most people get them when they're middle-aged or above in areas that have had skin exposure.
The top cancer killer in this country is lung cancer. Between 80 and 90% of deaths relate to lifestyle.
Cigarette smoking, everyone knows, is the single largest cause of preventable cancer.
The CDC found that 2/3 of cancers are preventable. When you take tobacco off the table, the next fueling factor is obesity. Studies connect it to a higher rate of breast cancer in postmenopausal women.
Obesity, I think, has been known for a long time as one of many risk factors for breast cancer, but what's particularly important is that women keep a low-fat diet and make sure they exercise.
Excess weight and low physical activity also impact esophageal, colorectal, kidney, pancreatic, and endometrial cancers.
We think that there's an element of inflammation that is established and becomes chronic in patients who are obese, and that inflammation can somehow affect the immune system.
The vast majority of colon cancers can be prevented through screening and removal of precancerous polyps.
If you get a colonoscopy, we see a polyp, we take it out, 90% of the time you won't get colon cancer.
Both the Pap test and HPV vaccine are decreasing the number of cervical cancer cases, adding it to the growing list of preventable cancers. For Lee Memorial Health System, I'm Amy Oshier.